Well, October is Breast Cancer Awareness Month, and we're going to learn more about screenings and what you need to do. Joining us today, she is Dr. Nicole Nelson. She is the Medical Director of Radiology at Mercy Health St. Rita, and thanks for coming today.
Thanks for having me, Holly.
Okay, so let's start. What are the current guidelines for getting a screening for breast cancer?
Got it. So the current guidelines are to start getting yearly screening mammography beginning at age 40 for average risk women.
All right, so then it should be every year then after that, or can you skip years when it comes to mammography?
You know, it's really important not to skip years. One of the things that we look at is there changes over time. There are certain types of breast cancers that pop up, you know, overnight, but there are certain types that are slowly growing, and we really see them when we see that change over a couple years. So it's really important to come every year.
All right, so when you're like looking at every year just to look for the tiniest changes. I mean, that must be tedious.
Absolutely. So if this is now 2024, I will compare back to 2020, 2019, 2018, because people's breast tissue looks different every year. You know, depending upon what time of the month it is for people, or if they've had a lot of caffeine, or if they've gone on hormones, off hormones, if they've lost weight, if they've gained weight. So having lots of prior mammograms is really helpful just to see kind of changes over time. And, you know, maybe in 2017 they looked more like this. So I use lots of prior mammograms just because I don't want to miss anything.
What about if you've been told you have dense tissue, you know, when you see that? So what does that mean to begin with?
Yeah, so in the state of Ohio, for the past few years, women have been required to be notified if they have dense breast tissue. Now it's national, so there's kind of this new buzz in the news. And what it means is over 50% of the tissue that we see on mammograms is white, is dense. And so it makes it harder for us to detect cancers when they're really small. For those women, there are a few options. So first of all, they all get a letter in the mail. But the options are to do a screening ultrasound. It's called ABUS. That's been proven by the FDA to find cancers earlier. We have that at St. Rita's. They also have it at Lyman Memorial. It's been a great technology, so a lot of women will schedule them on the same day. So they get their mammogram and their ultrasound on the same day. And it can even keep people from getting called back. For example, if there's just a simple cyst in that breast and we're like, it's probably a cyst, but they're gonna have to come back. If they do the ABUS on the same day, we can say, yep, simple cyst, we'll see you in a year for both exams. And that is for the women with dense breast tissue.
Okay, do you know, does insurance pay for that, for both tests, or?
So the answer is it depends, right?
Okay,
so for the screening mammogram, yes. They're working in the legislature to get ABUS paid for. It depends on your insurance company and your plan, right? So not all Blue Cross Blue Shield pays for it. You know how every employer.
Sure, yeah.
I've just we all just say just call your insurance company because it is different across the board.
Right, yeah. So do you know, are more people at risk? What are the risk factors then for breast cancer?
So the risk factors are being a woman. And then I'm going to do the obvious ones and then the ones for all of us. So if you have a family history of breast cancer, particularly a family member who is premenopausal, that puts you at an increased risk, but also postmenopausal breast cancer. And then if certain gene mutations, and then for the rest of us, it's just like everything else in healthcare that we nag about. Healthy diet, healthy weight, no excessive alcohol, all those factors increase your risk for all cancers. So, and smoking, try to just a healthy lifestyle.
Right, yeah, exactly. And you try to make it easy, right? I mean, it's easy to schedule an appointment. It doesn't really take a long time. I mean, what can people expect when they come to get a mammogram?
That's a great question. So a lot of people are very nervous to get their mammogram. It is, some people say it's uncomfortable, right? I'm not gonna say otherwise. But it's quick. The staff at St. Rita's are spectacular. They talk you through it. They tell you everything that's going to happen. And really, it is quick. Each picture is about 4 seconds, 3 seconds. It seems longer than that when you're doing it.
Well, they're like, hold your breath. And it's like, not that long, really.
But it really isn't that long. And they are great at accommodating people who don't stand as well or have balance issues or people who are just nervous. We do lots of nervous at our center. We're used to nervous, and we'll get you through it.
Right, yeah, so get the mammogram done. All right,
absolutely.
Thanks for coming today. Good to see you.
Thank you for having me.
All right, don't go away. New Edition continues in a moment.